Well, here we are again. We're back on our feet. We're at Borders Books, and we haven't been here since Carol Sears Honig joined us here for her wonderful new book, and we talked about it. And it's been very successful, so perhaps today will be the beginning of a whole new world for our friend Debbie Ribis. How are you, Deborah?
Fine, thank you.
I'm so delighted to see you. We've been friends for a very long time. And if the struggle of the human race could be embraced in a book that's 171 pages long, it's in this book. It just happens that we go back a very long time, and I have watched her struggle with the writing and the rewriting and the editing and the copywriting and the publishing of this book. It's almost like having a baby, and that's probably the closest I'll ever come to that experience, Deborah.
Exactly.
It's great to see you here.
Thank you.
We're here on the 30th day of January 2006, the 56th anniversary of that radio station that I worked for all those years today.
Oh my gosh.
And I was trying to think on our way here today when it was that I first met your colorful daddy, the late Papa Joe Ribis, but it's well over 40 years ago.
They came here, I think I was 2.
Oh, we don't have to tell how old you are, Deborah.
That's okay, I'm proud of it.
But they came here, we'll just give people a general time scheme here. In the 50s,
No, they came here in the early 60s.
but I thought your dad came here before that to help establish some Teamsters.
Early 60s.
Early
beginning of the
60s. All right, well,
Yeah.
it's very possible that he and I pulled into town on the same day then, because I got here to begin work at WEAV, local radio station, on July 4th, 1961.
Oh,
And it seems like I knew your dad and your family forever and ever and ever and ever. And for the people who don't know, Papa Joe was another one of those local icons. And not
Yeah.
only that, he was such a dear friend. He was a bartender in a few places that I tended to frequent back in the early 60s. And then he ran his, 2 different locations for his restaurant, or 3?
he had 2. My mother had the 3rd.
The 3rd.
My mother had the 3rd after he died.
Papa Joe's. And I forgot what year he died. You know, everything blends one into the other.
1990.
Come on, 15 years ago?
16.
16 years
1990.
ago now? That's hard to believe.
January 17th.
I have to tell one anecdote, because
Right.
it's, you know, you are who you are because of your mom and dad and other family members and people who nourished you through the years and encouraged you. But we were at Papa Joe's restaurant when my son Gordy, our son Gordy, was home from college. Football player, yada, 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 Cornell. We went to Papa Joe's to take him out to dinner. Calvin's perhaps heard this story. And we walked in, and you know, your dad always came over, Gordy, how are you? And he brought a huge bowl of salad for the table, right?
Yes, he did.
And I'm here talking with your dad, right? And I turn around, and the bowl of salad is gone. My son Gordy thought that was his bowl of salad, and he ate the whole
Well.
thing. He ate the first entree and ordered a second entree, and I said, I'm not going to get out of this place with my wallet left. And your father thought that was the funniest. He had never seen a kid eat that much in his life. So it was a great
It gave
experience.
him great pleasure.
It would have. And you know, long after your dad died, we went to your mom's restaurant, which was out on Route 9 north of town.
Where the silo is.
And she's been retired from that business for a long time.
7 years. 7
My
years.
goodness. So let's go back to the beginning. In your case, you've been a nurse now for almost 24 years.
24 in May.
Hard to believe.
Hard to believe.
The youngest person ever to get a nursing degree.
Yeah.
But was this something, now, first of all, then you pretty much grew up in Plattsburgh.
Oh, I did.
And went to what schools?
I went to St. John's, graduated from St. John's, went early admissions to Clinton Community College, had a 2-year degree from there in business. I was out of there for a few years and said, I want to be a nurse. I've always wanted to be a nurse.
Really? It was
And I
just
went back.
built in, huh?
It was built in.
Some people know from the time they're very young what they want to do with their lives, and I'm going to be 69 years old, and I have no idea what I want to be when I grow up.
My mother is a saver and a collector, and when she moved from her house to the apartment that she lives in now, she had saved a lot of our things as we were growing up.
Yeah.
And I was surprised to see how many toys and books and stuff that I had as a child that revolved around nursing.
Little stethoscope.
Yeah, when I look back over it, it was.
What was
I
that game we
pretty
used to play when we were kids?
Operation.
Operation.
Yes, I had
remember
it.
you put the little thing in the tweezers in the, yeah.
So I had, I think I was
always
just
killed the
destined.
patient, by the way.
I was destined to do it, and it's been great.
It's nice when you can recognize that destiny and then pursue it. And this is, speaking of pursuing it, this book is a dream for yours, and we're going to spend a lot of time at it. If you, the viewers, are interested in your health and in health care and what to do when you get sick, I mean, God forbid that any of us ever get sick, but guess what? It happens. And if you know what to do, this will help you. And I want you to stay tuned because you're going to get a liberal education as we sit right at this table. Stay with us. Well, we've taken a sip of coffee and we're ready to begin. So we have you as a little girl always wanting to be a nurse. Hopefully you didn't perform any appendectomies when you were 7 or anything, but you always wanted to be a nurse, so you went to Clinton.
Went to Clinton, graduated from Clinton. The first, I believe 7 years. It's kind of foggy now, specifically when I was at CVPH. And then I left there and went to Burlington, and from there just kind of expanded my career.
Did you want to focus on some particular avenue of nursing in the beginning, or was just a natural progression, or how did that work?
I didn't know what I wanted to specialize in, and I don't think you can until you actually start doing it, because what we think or what we're exposed to in nursing school and then what we actually experience when we're in the real world is a little different. But I was terrified, to be perfectly frank, of intensive care and critical care nursing, and it turned out to be the love of my life.
Isn't that, and the same thing with our daughter Barbie, who was in critical care all of her nursing career.
It absolutely terrified me, the thought of it, and it was the most amazing time of my life between working in the units and working in the emergency room. I worked in Fletcher Allen's ER for a few years, and it was just an amazing time.
That's called a bath by fire when you work in a Fletcher Allen emergency care, or in any hospital's emergency
It is.
room.
And my first weekend definitely was baptism by fire.
It's amazing, but you learn what you're made of, and I guess you learned pretty early that you had the right stuff. Was there ever any doubt in the beginning?
About nursing,
Yeah,
or
about nursing, about the field once you got into
no,
it?
not at all. And I was very fortunate. I had a very strong family. My grandmother was, I think, my biggest supporter for me to become a nurse. And she absolutely had faith in me beyond. And she was the strongest person I know. And I think she gave me strength.
That's good when your fan base starts with your own family.
It was great. And now I have my son.
Of course. He's
So-
sitting over here in the corner. Is it Jason?
Jordan.
Jordan, I mean. Okay, I got you. Nice to have you here with us, by the way, Jordan. So you had this nursing career, and you're still doing it.
Yes, right now I work as a medical case manager. I do medical legal reviews, and I'm a certified nurse life care planner.
And after all these years doing this, you decided that you've got to share some of this knowledge because, I mean, a book doesn't just jump right up on your coffee table.
No.
I'm very, very interested on why you thought it necessary to write this book at this time.
Several years ago, I had a work-related injury. Actually, it wasn't work-related. I fell on the ice. It was this time of year, February 6th. Fell on the ice and I got a compression fracture. So I had a lot of time to be home and just kind of ponder where I was going. And I started having some trouble dealing with the insurance company at that point. And I thought, oh my gosh, there must be a book. So I went to the bookstore and there was no book. And I have never been formally trained on the computer, so to go and do a computer search was even harder. I had my son looking, and there was nothing formalized out there. Whether it was for work-related injuries, I mean, there are tons of books about heart disease, diabetes, every disease entity going. But there isn't a book that tells you how to wade through the insurance systems, whether it's compensation or disability or managed care or indemnity health care, or if you don't even have any insurance, do you have any rights? How do you get through this system? And then how do you deal with the medical community? How do you deal with, let's say you're not having good success with your treatment and you're looking for other options. Do you have other options? And if you're kind of recuperating from a procedure, a injury or an illness, or just trying to settle into living with it and making it part of your life, how do you deal with that sort of system? How do you deal with the rehabilitation industry? How do you deal with employers if you're working, whether it's work-related, if you're on compensation, or if you're just out on a personal disability for a medical illness? Where does the interaction with the employer, and what is everybody's role there? I couldn't find anything. And then the community and your family. And I said, well, I have all of the notes that I had from my own experience. And I started making my little yellow legal pad notes. And
you're good at that.
Oh, it's a bad thing.
You're good at that.
It's a bad. And I ended up with just stacks of notes from my own personal experiences. And then as I had questions, I would either be calling the carrier themselves and get partial information or wrong information. So I did a lot of work one-on-one, just getting my own answers from the state agencies. And as I started doing research, when you're in nursing, you have to do in-services there. You have to keep up on what the current laws and the rules and the regulations are. So it just kind of fit. And I had all of these notes, and I thought, well, if I have these notes, I've got 24 years of experience, I need to share that information because it is not out there. There is not one source for it. And there we are.
It's amazing, and fortunately, because you and I have known each other for a long time, you shared this information first with me.
Yes, I did.
And everything with you seems to be a massive struggle,
yes,
an undertaking. As she said when we met in the hallway here at the mall this morning before we walked into Borders Books before 9:30, what are we going to do? I'm a control freak. I have to know. Well, Galvin and I don't know exactly how these programs are going to go when we start, and it's the extemporaneous nature of the programs that make them, I hope, more charming. And when you have the information in your head, it's easy to share with people. But in the beginning, when you told me this idea, I knew it was going to work for you because I know that you do not. One thing about you is that
No.
you do not give up.
No.
When you reach an obstacle, you just go back 2 steps and charge.
I have a little bit of my father in me.
Yeah, you got a lot of your dad in you, and he would chuckle and laugh if you were looking down, and we're sure he's looking down at us today to see what you're doing. So this is not, the title is to get back on your feet, getting back
Right.
on your feet, but it's got a subtitle, which is what?
What every injured and ill person needs to know.
So it's not only information, but it's a workbook. And
Right.
it's the whole, if you had to describe in a sentence what the concept of the book is, I would have to say it's letting people know that they can take control of their own situation.
You have to take control of your own situation. Nobody is going to do it for you. Insurance, medicine, rehabilitation, your job, everything is a business. And they stay in business by watching out for their bottom line. And I think the bottom line for you as an individual is your health care, and wading through all of these systems has to be your business. You, through an employer, or if you buy it individually, you're paying for insurance. If you are unfortunate enough not to have insurance, you pay premium dollars for health care. You need to know how to get the most for what you're paying. People will go and buy a car, and they will drive all over upstate New York trying out different cars and seeing what the best deal they can get is. And they look at the book and they know all of the stuff about this car. But if you talk to them about their health care insurance, I'm not talking specifically about their individual disease states, but how to get the most from their doctors, the insurances, and everybody involved in the system, they have very little idea. And every single person I talk to has a story. They all have problems. I have not talked to one single person in the last 3 months, and I talk to people every day. Every single person has a problem with their insurance, their doctors, billing issues, the entire industry. And nobody is out there telling everybody how to get through it. And there are lots of agencies that are set up to help you, but if nobody directs you to them, how do you access them? And most people that I know are not really super computer literate. We use it for our
know
jobs.
how to do it.
We
Yeah,
get through
we
it.
know how to write on it.
Our kids grew up in using computers when they were 4 in nursery school. I didn't even know what a computer was, but I didn't even know they existed.
Nor did I.
But what I tried to do was put this together. And even the title is talking about getting back on your feet. Getting back on your feet can be a very literal thing. You can actually recover from your injury or get over your illness, or you get to a point in it where you say, okay, now I need to incorporate it into my life, and I need to get back on my feet in that respect. I need to take back my life and work around this problem. And you may end up for long term dealing with these insurers and this whole situation.
It's obviously there was a need, and you recognize that need. You didn't write this book because you wanted all kinds of personal publicity or the personal satisfaction of having done it, and it is satisfying. But if we were to go back and analyze all the sleepless nights you've had and all the problems you had getting this information together, you would almost say, my gosh, I'm not sure it was worth it. Until now, you have the finished product in your hand, and there was such a need for this book that you know it's going to do well, and so you're able to help people.
I had a lot of support as I was writing it, just trying to focus in on it. I'd never written anything. I mean, you write papers in school, and I write reports for the jobs that I do. But to actually compile it all and make sense of it, I tried to write it so that you can understand it. I didn't put it in a medical or legal jargon. It's not intended to replace legal advice or medical advice. It is simply giving you the tools to find out where to get the information you need. So I took the information and I put it in here. It was, you said before, like having a baby. And once it was done, it was exactly like that.
Every time you would do a rewrite, you would send me a little email.
I said, oh my God.
I don't know how many rewrites there were, because you were so constantly changing and editing and moving pages and paragraphs. And
I have printed off, each time we would just about be done, I would print off the whole thing so that I could watch the progression of it.
That's a lot of ink cartridges.
But I think I have 8 or 9.
Can you imagine?
I talked to a woman who has published books in the past, who's had her own books published, and I says, oh my gosh. And she says, before any writer gets a book published, you will rewrite it at least 6 times. And I thought, absolutely right.
It makes me want to get into that business with great trepidation. To have to take a book which is 171 pages?
Something like that,
Something
yeah.
170 some pages, and do it over and over and over again. But this is different from should I use the word memoir in light of recent
Right.
publicity? This is different than a novel, different from a piece of fiction or even a biography, because you really worked hard to make sure your information was accurate.
I tried
Factual.
I tried to make it accurate and factual and make sure that you could read it and understand it. Because most of the terminology, most of the subject is basically foreign to us.
Yeah.
And I put a whole reference section in the back trying to make it a handbook. It reads, it gives you the information you need, but then in the back it also gives you the tools you need to take it the next step further.
I was, and I'm patronizing you because we're sitting together and we're friends, but I was very impressed with your writing style. And when you first told me about this book and you sent me chapters to look at and possibly review, I said to my wife, Kay, this is amazing because it's written in language I can understand, unlike any medical related book that I've ever read in my life. And for a first-time writer, I'm very, very impressed.
Thank you.
So you actually spent a lifetime collecting information for this book, and you reach at a certain
That's what
point
it
and you
is.
think you can start putting it down on paper, and then you just go and go and go. I know your copious notes and files and unbelievable.
It was literally just yellow pads, and I took scissors and cut the notes and I put them into piles. There was
Is that what you
nothing.
call cut and paste? That has a slightly different
that
meaning.
was the original cut and paste.
That's what I'd have to do.
And I had no formal plan. I had written out a list in 2000 of main issues that I had. So a rough table of
So this
contents.
concept goes back to 2000 with you?
Yeah, I fell February 6, 1999.
Wow.
So that fall was probably one of the best things that happened to me because it changed my whole life. It forced me to change everything. So when I meet somebody who says, oh my God, you have no idea what it's like to have to change jobs, and you have no idea what it's like to have poor medical care, or deal with these insurance people, or deal with the rehab industry, or how do you incorporate living day to day with a chronic problem? I have been there, I have seen it all, I have done it all.
Some of us are fortunate to be healthy most days of our lives. As we sit here late in January 2006, I got up feeling good this morning, and I was grateful for that. But a lot of people don't get up feeling good in the morning for one reason or another, either because they've just got a sudden catastrophic illness, or they've had an injury, or an automobile crash, or whatever the reasons are. And you handed me some statistics that are rather startling. 2001, 880.5 million visits to doctors' offices. Wow.
Those are staggering numbers. So, and it gives you an idea of how many people, this is in the United States. This doesn't include Canada or other countries. This is our country. So everybody is touched by the need to access these systems.
99.8 million people injured or poisoned in 2001. In 2002, 83.3 million visits to the hospital outpatient rooms. And listen to this, it's called staggering, and it really is. 107.5 million visits to emergency rooms, 2001. 39.4 million for injury-related complaints.
That's for 1 year.
So this book isn't written for 5 people, it's written for millions and millions
Right.
of people.
When I talk to, I am going down to Plattsburgh State next month in February. And they said, well, why would it be something our students can use? And I said, the main thing you need to remember, the students, right now they're working with their parents' insurance, most of them. There are some that have their own insurance because they're older students and they've gone back.
They're talking about health insurance.
Health
yeah.
insurance. At some point in a couple years, we hope that they're going to graduate and be out and have to use it themselves. Yet they need to know how to access these systems. and they need to know how to get the most benefit from them. Because if you don't, I mean, if you accept a denial from an insurance company and you just accept it as face value and you don't pursue it, it can give you a very negative outcome on your health care. You might not pursue other treatment options that technically are available to you. If you are seeing a physician that you're not happy with, you want a second opinion or a third or fourth opinion, whatever the case may be, you need to know how to approach that and pursue that. Most people, I've met patients, in the last year, I review medical records every single day. And in this last year, I actually met a man who said, I need another opinion. And his physician said, I'm not referring you. It's not covered. Fortunately, we were able to turn that around for him. But most people take it at face value what they are told. They are given misinformation, sometimes by their doctors, sometimes by the insurance, many times by their staffs, the insurance companies, and they don't pursue it. If you look in the back of your health insurance book, there is a whole section on appeals. Most people have no idea what that means. What would I need to appeal?
Well, you know, it goes back to when we were kids, you had absolute and ultimate respect with your teachers,
Absolutely.
with your school principal, with your physician, with your priest or clergy person, with the President of the United States. Times are changing, and all of us are, I won't use the word skeptical, but at least we're gaining awareness that we can, in the words of your book, take control of our lives. And rather than trusting all these people implicitly, we have realized that we have a right to question certain things and to at least learn about it. And I had a perfect example this morning, and I don't want to monopolize this conversation, but there was a national news story today about a program called Food Stamps in America, a wonderful program for people who need it, and only a tiny portion of the people who are eligible take advantage of the food stamp program because they don't know, or they don't care, or they're just not willing to take control of their own lives and find out that there are resources. This book is a wonderful resource, but there are lots of resources in the world to help people who need health care if they'll only ask questions.
But they don't, and you said it exactly. You said the exact problem is that people are intimidated.
Yeah.
And I look in my family, my mother, my older relatives, your generation are not willing, or you have a different relationship and you don't challenge things the way my generation does, and certainly my sons. There's more emphasis today that healthcare is a business. It's a consumer-driven business. But as I said before, we go spend more money looking and more time about our cars than we do trying to find out where we get the best benefit that we can from our health care, whether it's from the physicians, the insurance, or everybody involved in the system. I think it's very important when somebody goes to do the research that they have accurate sites that they can go to. I feel really strongly that when you go if you're going to go on the internet or you're going to go to chat rooms, make sure you have accurate information. So I've tried to put together some formal sites.
Well, you did, and that's a good thing too, because some of us have come to rely on the internet for lots of information, and Calvin knows, he and I have discussed it all the time, because we each spend a lot of time noodling around looking for things we're interested in. And there is such a huge amount of misinformation, completely inaccurate information. How many times a day do you get an attachment to an email that says, tell all your friends, such and such a company is putting out a new soda can, and it's you know, this and that, and you go, and they're easy to check out. And these are just flat out hoaxes.
Right.
And it's really scary when it comes to healthcare, because there are a lot of schemes and things put on the computer telling you how to save your life or save somebody else's life that are completely bogus and downright dangerous. So you better find out what's accurate and what's not.
One of the things, last year I was actually doing some private work for as a consultant, and I read some information in the file, and I thought, my gosh, this patient was given wrong information. There was no question that it was wrong. But it seemed to be disputed more through the record, and as I read through it, I thought, my gosh, this seems to be getting even deeper. I actually called the state agency because I wasn't sure, and it was a southern state, and I said, well, I'm not familiar with your state laws, but can you tell me, is this accurate information? And she said, no, that patient has been lied to, straight up. There's no question, that is a lie. So if you don't follow through, I mean, most people are not going to come out and intentionally lie to you, but some people will. And I think knowing that, it makes me skeptical enough that if I am using a certain system, I want to make sure that the information is accurate.
Your life and my life over the last 8 years has been concerned with the word advocacy. You've done that for a long, long
Right.
time. I became a crime victims advocate and helped people, but you've used the word advocacy, and I've read, just to give an example, how your book is being embraced in places that you don't know about. I went on the internet today, and maybe 30 or 40 pages are dedicated, many, many websites, to you and this book and your publishing company that took a chance and published this. Because people are interested and they feel as though there's a need. And the word that it recurs page after page after page is advocacy. And, you know, sometimes we need an advocate.
Absolutely. I do a bi-monthly column for the Press Republican.
Yes, you do.
And it's called Healthcare Advocacy. And I just started, when I just had my first published in January for the Senior Sentinel, called Healthcare Advocacy for Seniors. And having an advocate doesn't mean that you're having a babysitter, and most people equate that. When I tell people you need to have somebody kind of on your side, it has nothing to do with the fact that you're not smart enough to take care of yourself or you can't figure it out, but it really lends more support to your cause. I saw it firsthand earlier this year with a family member who was ill, and you need to have somebody there, and it doesn't matter if you're 8 or 108. You need to have someone go with you. I absolutely would beg people when they go to see their physicians, and of course the physicians are not all happy with my advice, but take somebody with you, because you need somebody to help you remember what the questions that you have are and what the treatment plan is. A lot of times you've got 35 seconds. The guy comes in, they check you over, and you're done. You need to have somebody go with you. And if there's a problem, you need to have somebody to give you that support to deal with the problem, because most people are very intimidated.
Did you, you had this book pretty well written before you ever found a publisher?
It was completely written.
I know.
I did it backwards.
Now, no, that's perfectly all right. This is the way I operate too. Although, with the exception of my columns and things, my work, none of my stuff is published. So I've watched you with great admiration, because you took your own advice and you never gave up. You had the book going, you had an idea how you wanted to put it forward.
Right.
Beginning, you know, with the first pages telling people not to be intimidated, but teaching them that they can take control and at least learn about their situations. And then with an actual workbook in there, and you got it all together. And then, in the process, you started presenting it to publishers.
Well, I tried, first of all, the process is they tell you need to have a literary agent. It's a very thankless process. It's very demoralizing.
It
And
is
if
discouraging.
you're not a real strong person, it would be easy to give up. But I knew that there was something here. I was very, very fortunate. I was talking to one of my friends in Vermont, and I had just about had it with this whole literary agents. And
I know the feeling, that's why I'm laughing.
blowing off some steam, and I said, "Oh my God, you don't know anybody in publishing, do you?" And she says, "Oh, as a matter of fact, I do."
That's what it
And
takes.
I said, "Are you kidding?" And she said, "No." And she gave me the name of this woman to call. So I called, and I don't know if you've ever tried to call a publisher, but they'll cut you off dead at the first
sure.
word out of your mouth.
You don't call them on the phone.
No. They'll hang up on you, and or they'll tell you off first, and then they'll hang up. So I thought, oh my gosh. So I had to tell her that, my friend Mary Beth had given me the name, and could I at least talk to her for 30 seconds before she hung up, because I had this book and I was trying to just 100 miles a minute get out what I had done.
Yes.
And I had no idea of the woman's role in the company. And she said, "Well, I'll tell you. What I'd like you to do is send a synopsis and maybe your table of contents so I can see." And I said, "Well, okay. Can I also send you like 2 chapters, just because I think sometimes when they talk about the synopsis, it's hard to get the full flavor of what the writing style is and what the message of the book is." So I sent it over, and she said, "Now, we won't get back to you for a month." And 24 hours later, I had a letter, and here we are. But they made very specific recommendations, and I had to rewrite it one more time.
But you got your foot in the door.
I got my foot in the door, and I didn't give up.
Many of us, at least in our own estimation, have pretty good literary products. But the next thing is to find some way to publish it. Fortunately, there are myriad different kinds of companies who will, print on demand, who will, with a small outlay on your part, publish your product. And if your main goal is just to see your name in print and a picture on the front that says Deborah Ribis, then there are a great many ways you can go. But to get a reputable publishing company and to get somebody to back you and to help you publicize it and market your book is very difficult. You found a real fan in this woman from this
They've
small company.
been very supportive.
You were on the phone with her sometimes daily, sometimes several times
I still
a
am.
day.
I still am.
And that's why I said I was impressed when I got online this morning, for people who are just looking around the internet and who just Google your name, as they say, to use, Google my name. And there it is, in page after page of Deborah Ribis. Ooh, cool. So anyway, the process from the time you first talked to them until the book was published, technically in January 1st, right, 2006, was how long? Just to give us an example.
I talked to them July 17th, 2004. And then they sent back the letter the next day, and they made very firm recommendations of what I should change or how I could improve on it. And then they strongly urged me to resubmit it. So I thought, well, okay. So I rewrote it again. That took about 3.5, 4 months. Resubmitted it, and then at that point, it took me another month. They wanted a marketing plan, and I had a contract. But the bottom line is, if you're going to go through this process, they're the experts in publishing. Your editor knows about where the commas go and the semicolons and all of that sort of stuff. They know how to make the sentence structure the way it needs to be grammatically correct. You need to follow them. You need to kind of work with them. I was able to offer my opinion when they would say, I think this needs to move here, and I was able to provide the input as to why I wanted things to stay where they were. But it is a process, and you really need to work with them. And if you want them to back you, the bottom line is they're pretty much calling the shots.
Are you happy now that you chose this company, or that they had faith in
Absolutely.
you?
Oh yeah, this is great because the nice thing is they're a small company, so I'm not lost in the shuffle, so to speak. I think, I mean, I can only imagine it would be great to be working with one of these big, worldwide names, but at the same time, it's really nice because I got some one-on-one attention with this, and I had input from day one. They involved me in every step of the process.
It's nice, and they made you featured author of the, what was it? Featured author of the month or something? I was trying to, yeah, look at this. Women in print, featured author. I was so proud of you when I put this,
Geez.
you told me about it, and
Thank
I
you.
opened a web page and I said, oh, yes. It's very nice.
Thank you.
So now the book is finished.
Right.
It takes a while to digest what you've done so far. Some days you'd like to take back. We all like to take a few days back in our lives from time to time. But in the end, if we're successful in our quest, then we have to look at the journey as having been worthwhile. And in your case, at least, once removed from this process, I would say it is. I mean, personally, I'm very proud of how you're stuck with this whole thing since the very beginning. How you've done it and remained sane is almost beyond my understanding. Because I can almost see the struggle. I can see the sweat and the emails that you sent me along the way.
It's a terrible process at points, but I just look at my life and I think that everything I was given in my life was a blessing. Do you know what I mean?
Oh, yes, I do.
I
It's hard to take personal credit for who we are.
I
'Cause
don't think I have much credit here. I think somebody much higher than the rest
Yeah,
of
I
us
believe that.
took care of this and gave me the opportunities. And I think whatever we're given in life, we need to give back. So I really wanted to make sure, because I look at my career and I'm excited about what I've been able to do. I've been involved in so many different aspects of nursing, and it put me in each one of these industries. So I speak not just as somebody who's, had an injury and tried to go, but I also speak as somebody who's worked in it. And I think that gives you a whole different,
In the trenches, so to speak. Many people,
all the way.
and we've all read, seen books, done television shows with and about people who are self-proclaimed experts, who have done a little research and a little reading and have written how-to books. How-to books are popular. There are many of them in this store, Borders Books, where we're taping this interview in the atrium in the back of Borders Books in the mall in Plattsburgh. And there are a lot of how-to books. And sometimes they're written by true experts. And I have to say that regardless of how people accept or deny the credibility of the information in your book, they can't deny that you've been there and done that,
Exactly.
to quote a rather worn-out phrase. You have been there. You've been there with people, with patients, with doctors, with the companies. So you're writing from your vast experience. And you've dedicated your entire life to the nursing profession. So you're not a Johnny-come-lately. You may be a newcomer to the book business.
well, yes.
But when you pick, that wasn't a metaphor that I didn't think about before I said it's like having a baby. This is your baby, and now that you look at it today, having gone through the labor process, right? Now you're watching the plant grow, and you have to be pretty pleased today as we sit here on the 30th day of January in 2006 and say, yeah, I did it.
Well, it's pretty surprising, and probably you'll see when you start putting all of your stuff together, you see your work in bits and pieces. So until you
Perspective is the hard word,
until
isn't
you
it?
actually see it done. I mean, to be honest, it was stunning for me to actually see it done.
Well, I had no idea, and having gone through this process with you as your friend, I knew what it was going to look like. I didn't know it was going to be 800 pages
I had no
or
idea.
170 pages.
I had no idea.
Soft cover, hard cover, There's so many things to think about. The format of the book, the size of the pages, the
Yeah.
print, those little, we used to call them gagging gnats.
Yeah.
And the publisher calls and says, what kind of print do you like? And I say, what kind is there? You know what I
That's
mean?
What color paper do you want? I said white. I had no idea how many colors of white there were.
Or what font, or what, yeah.
You know, I was glad that I was involved in that process, but it was very strange to me because I just thought that's what the publisher does.
Yeah.
But I wanted to make
At
it-
least they were very careful about getting your input on everything.
They were.
How about the title itself? Was that your idea?
The subtitle
Get-
subtitle is my original copyrighted title.
Yeah, but get back on your feet.
Get back on your
Grabs
feet.
people.
We spent months trying out different titles, and it was on one of the lists, and we just, that's it. And we were originally going to leave off the subtitle, but then when you look at the subtitle, it really explains it. Initially, this book was for injured people. I was going to do one, what every injured person needs to know and what every ill person needs to know. I was going to do two separate
Two
books.
separate.
So I tried to combine it all and make it meet the needs of somebody, whether you're 18 or 80, and whether you're injured or ill, whether it's work-related or not work-related. It's been a process.
So the book is done. It's out,
Mm-hmm.
and just give me some of the responses people have had. You've obviously talked to people who've read your book.
Right. I've gotten excellent feedback. Excellent feedback. People are surprised. One of the first ladies to buy the book actually called me up and she says, "Oh my God," she says, "I knew what it was about, but," she said, "I didn't realize how much of a handbook it is." She said, "I just need
Handbook
to."
is a good, that's a
She said,
word I
really
haven't
need-
used yet today,
I
but it
really
is
need
handbook.
to keep it with me. She said, because I keep referring to different parts of it. And that's a really important thing when you actually start to use it, is that you can go through, you can look at the table of contents and try and find what section you're having trouble with, go down, and it answers a thing. One of the things that I did, we put in things to remember and questions you need to ask. So sometimes it's a little wordy and you think, oh my gosh, I don't think I can read through the whole thing. But if you just went to the end of each chapter, this particular chapter here is talking about medications and special equipment needs. Things you need to remember, questions you need to ask when you go, whether you're dealing with the insurance companies or the doctors or whomever you're talking to, at least answer those questions for yourself.
It is a how-to book, and I'm so glad you mentioned the word handbook, because that's what it's all about.
Right.
People can refer to it, and it's almost like a thesaurus or a dictionary or an encyclopedia, and it defines terms, so it's a glossary.
I did put a glossary in here also, just of the terms that you run across, not specific, again, to individual diseases, but to terms you run across with this process.
You know, it's a good thing. I'm very pleased that you asked me to write a review about your book, and I was very honest when I said what I said. But so were other people who were a lot better, well known than I am in the
Right.
business. Not the least of which is Assemblyman Chris Ortloff, who looked at it and saw that it was a much needed book.
He's been a tremendous source of support.
And people in the business also have supported
Right.
you.
People in case managers, nurses, I've gotten some tremendous feedback from physicians. It really is something that anybody can use. Physicians can refer it as a source of reference for their patients who are struggling, because I met a physician Wednesday who said, "Oh my God, I've been trying to find this information for my patients." And I said, "Well, here it is, go to Borders. Borders has it." And when I talk to insurance companies and they're saying, "Oh my God, I have patients that are really struggling." Some adjusters are really trying to help their clients and their claimants get through the system. And they aren't all out there trying to deny care and make the most profits that they can at the expense of their claimants. attorneys who have clients call up and say, or potential clients call up and say, I have this problem, what do you think? Should I, I talked to a paralegal down towards Albany, and she said a lot of times they will have potential clients call up and say, I have this question, I have this problem about this client, or the care that I've gotten. And the attorney can't always take the case. But she said, we have a resource now to refer them to dealing with the system. It becomes very cost prohibitive sometimes to hire an attorney. So they're referring it at case managers, the vocational people. I've gotten some great support from vocational counselors who are working with people. Typically, vocational case managers are working with people who have been injured or ill and who need to be finding new resources and new ways to get on with their lives. So they're seeing this as a really good resource.
And who knows? The book hasn't even been out technically for a full month yet, although it's very close to that period of time. And you've got some things in the works. Now, this program probably won't be aired until later in February of 2006, but I thought when I first, and what do I know, but when I first saw the book, I said this should be a book that's in everybody's house, that's sitting right there, not in a bookcase, but sitting right there so people can look at it from time to time, because you're not going to live a long life, even if you're relatively healthy, without having some of the experiences that you talk about in this book. And the underlying theme is take control, don't give up, understand that there's always an appeals process. When people are making decisions about your health care, there's always a next chapter that you can take to get the job done.
And understand what your options are.
Options.
That's really important, is to know what your options are and be able to follow through with them, or find out how you can follow through with them.
So you got the book done, you got it out, you're hopeful. I would like to see, but once again, that's because we know each other very well. I think it's not just a book of the opinion of Deborah Ribis. This is a compendium of information that you've gathered from many sources. And I would like to see it perhaps at some point in time become a textbook. And I wonder if that's ever entered anybody's mind.
I have been trying to talk to some people at a couple of the different colleges, and we're working on that. It's hard to present that idea because they want a text specifically. My son is a biology major. He wants a biology text. This covers so many different things. I think one of the fields for nursing, for counselors, of course, for med students. The other thing is, most colleges require students to take an introductory health course. When they get that, they're telling them how to survive through the systems, how to, what you need to do to take care of yourself, how you get through different diseases, what systems are out there. This could be an excellent reference for all students, not just those in nursing or medicine or case management or counseling. It can be used by anybody. The teachers can use it for their own personal use. And I've got some excellent support locally, and it's just going to take some time to explain how it is. I don't think until you actually see it, you can appreciate the volume of information that it covers.
It's difficult when you write a book like this and get it published. Obviously, you'd like to sell some copies of it, not just for the personal satisfaction, but because you think there is a need. The area media here in the North Country have been pretty nice to you so far.
So far, they
not
have
to
been
mention
great.
the fact that Calvin's here with his hometown cable camera, and I'm sitting at this table with you. But other people have gotten, the newspaper, the local television station has been very kind to you. And fortunately, the website for this publisher is listing all your upcoming events, and you've got some radio interviews and some book signings.
It was picked up by the Watertown Daily Times last week.
Wow. No, but that's cool.
It is, and I've got a distributor that we're trying to negotiate with. So,
So with this particular company you're working with, I noticed on some of the websites today, and being very frank, it says that supplies of books are unavailable. I don't know what that means, neither do you. Does it mean that they're not available on the internet, or does it mean that they can't find them on site somewhere?
it may be at that particular vendor, but I know Borders here in Plattsburgh has it. It should be arriving for their in stock today.
Today?
Today,
Oh,
as we speak,
okay.
literally. You can get it directly from my publisher, womeninprint.com. Barnes & Noble and Amazon also have it. If you're searching for it and you can't find it, you go to one of these sites, and we need to discuss these sites after,
Yeah.
and you can't find it, I would tell you to contact the publisher directly. And as soon as I leave here, that's what I will be doing.
I wonder, obviously when a publisher has faith in a young author,
How nice.
it's very gratifying for them to see that this is successful. And people who are so-called experts don't always recognize. That's why a lot of very valuable books never get published, because people give up in the process. And that's why storylines never get made into movies and so on, because somebody has to look at that synopsis, as you said,
Right.
and make a decision on it. And this woman looked at what your information was and liked it, and now must be pretty happy that she's taken that step with
I've
you.
gotten some excellent feedback from them. You found the editor's blog.
Yeah.
I didn't know it was there, but it was an interesting process. The bottom line is, for anybody writing anything, if it's something that you believe in, first of all, make sure it hasn't been done 100 times. That we knew.
It's unique in that respect.
We knew.
You knew there was a need. You did your own marketing analysis.
I
in the
really did. I
beginning.
spent hours and hours and days and weeks trying to find the information, and it was not there. And I thought, well, at some point I need to find it. I need to put it there. And taking all of the information that I have and all the experiences I have was easy to just sit and write. And it was like writing, I think, a letter to myself, and just writing a journal of what I had been through, and taking the information. And
You've got a full-time career. Writing isn't the only thing you do in life. You you do this case management on a regular daily basis, right? And so I just want to let people know, people say, oh, that's a little book, that couldn't have taken it very long. This is taking you a lifetime if you were to count all your experience. But just in writing and rewriting, it's taken, I've gotten emails from you at 2 o'clock in the morning.
Yes.
When I was sound asleep and you were typing away, and you sent me a little email saying, I've only finished another rewrite.
really,
And so you spent, if you had kept track of every minute you spent in the actual writing
it's
of
staggering.
this book, it's staggering. You don't even want to think about it mostly.
I couldn't even begin to total it up, because when you're not writing it, you're thinking about it.
That's true. It occupies your dream, your wake.
Even when
and
you're,
your
and in
sleeping.
your sleep, I would wake up at night and think of things, and I think, I got to write it down and make a note and get up, because there's so much. Like you said, I'm still trying to work full time, and this was, something that I did the other time.
I just looked at a chapter here on page 117. Light duty is not always light duty. Wow.
That's true.
You're covering topics that people have thought about, but they've never read about
Well,
before.
most people go to their doctors if they've had an injury or they've had an illness, and the doctor will say, released to light duty.
What does that mean?
You need to know what that means, because for you as the patient, it can mean one thing. For the physician, well, he just says light duty, don't go back to doing what you were doing. And for your employer, that can mean an entirely different thing. Light duty can be what caused you technically to have the problem you have. You need to know the information.
I love the glossary. You mentioned that, because so many of us are unfamiliar with technical medical terms and insurance terms and doc terms that doctors use.
just roll right off their tongue.
I'm very happy with the way you treated the language in this book. And maybe it's because you haven't written anything professionally before
Right.
that the language is relatively simple, and I'm
I
happy
didn't
with
want
that.
this as a nursing book. As
Yeah.
a nurse, I know the information. Nurses know the information. They've actually got it within themselves. I needed this to be for anybody to pick up and read. They need to just be able to read it and not get caught up in the big words.
When I say workbook or handbook, I mean both, because you've got pages and pages of things in the back that people can keep track of their
Right.
own personal cases in. I just want to show a little bit of this. Tell me a little bit about what the workbook contains in the back here.
The workbook contains several forms. The first one is a very lengthy form, and most people start to look at it and they get very frustrated and they say, oh my God, another form to fill out. But it is your history. You are responsible for your history. And if you assume that your doctor has the information or that the hospital has the current information, you are sadly mistaken.
It may or may not be true.
And if they have it, it may be stored off-site someplace, and your health care can be jeopardized if they don't have the current information. This is to keep your life current. And you need to take control of keeping track of your life and your health care.
That's one of the most important things you have in this book, is to take control of your own situation, right?
You really need to, because somebody else is going to take control of it, and if you give somebody else control of it, then you've lost the whole ball game. The other thing in here you're looking at right here is a communications log.
Absolutely essential.
And people say, oh my God, what would you write that in there for? Because you need to. It is imperative that when you talk to somebody, if I talk to Gordy Little on January 30th at 9 in the morning, I need to make a note, because first of all, I'll forget. But second, I will forget when we talked or what we talked about.
What was the topic? What did you say?
What,
What information?
and what was the outcome? If I called and asked you a question, what did you tell me? Why is that important? Because it may help with an appeal later on. It may get something changed that was ordinarily denied.
We all live in an age where, you know, if you want to know about health care, press 1. If you want to know, press 2. And much of the conversations we have are computerized. How many times have I called in the last few days where they tell you to say something and you know it's a computer and we say thank you ma'am, and that ma'am is all bits and bytes
Exactly.
in there, right? So it's important to know whom you talked, with whom you spoke, their name, their first
Right.
or last name if you can get it. Some people won't give you their name.
Well, then give me your extension.
Give me your extension so that you can go back and refer to that. Because who can remember what they did 6 months ago or 4 years ago?
One of the points in here I talk about when you leave a doctor's appointment, or aside from just doing I want you to write down your telephone calls at home, but when you leave your appointments, before you get in your car, I want people to take this and make a notebook for themselves. When you get in your car, make a note. What did Dr. Smith say? He wants me to do X, Y, and Z. This is what he said is going on with me today. You need to make that note before you go to stop at the supermarket on your way home, or before you go to have lunch with your neighbors, because you will forget some of the key points. And that can really impact what you follow through with. I would really like to see, and again, I can just hear the groans from the offices already, but I would really like to see offices give people, whether you're a compensation client or not, or whether you're just there for a minute, a written discharge instruction sheet that says, we want you to take Tylenol every 4 hours. We're treating you for
Like they do in the ER.
Exactly, because by the time people get home, they've forgotten. And they have no way to reference it.
Yeah. It's just, you know, the illness or the injury is overwhelming enough, psychologically overwhelming. It's very easy for us to be overloaded in this world of so many different things, that we can't be expected to remember all the details. And that's why it's important, as you say, to write things down, keep information and notes. If you could see the sticky notes that I have around my house, trying to remember who I'm supposed to see, who I saw, and where I'm
The
going to go
forms
next.
in here are very basic. There's one that says questions to ask.
Well,
You
who
need to
knows that
make-
when they go in and they get their 15, we talk about our 15 minutes of fame.
That's
When you go to a doctor's office, sometimes you only get 15 minutes, right, to state your problem?
If you're lucky.
Sometimes it's less than that. So something as basic as writing down the 5 most important things you'd like to know.
When you're home and you've got an ache or a pain or something is not right and you know it's something I need to remember to ask him about, write it down. Because guaranteed as soon as you walk in that office, you're going to forget it.
Yeah.
So take the information that's there, keep track of it. If you are getting, there's another form in there I think that talks about your reimbursements. If you pay out of pocket for something and you submit it to the insurance company, keep a copy of it and make a note on there. I submitted my prescription that I paid for on whatever date. Because a lot of people get so caught up and so busy in their lives, they forget, they owe me $42 or I've paid whatever. If you're a compensation patient, keep track, a running tally, or if you're a disability patient, what day did I get my check and how much was it? Most of the time, every time, it technically should be the same day, every Monday or whatever your cycle is on. I got whatever that amount would be. Sometimes you will see some carriers, not all, but there are a percentage of them that tend to stagger it. And sometimes they leave off a few cents or they leave off a few dollars. Well, if you actually take and you add up, especially if this is over a year or a couple of years, they can actually be owing you money. And people say, well, they know what they're doing. Yes, they do know what they're doing. You need to keep track of what they're doing because ultimately it's coming out of your pocket. So that's the message I want people, is to take control, because for us to think that somebody else is doing it for us is crazy. It's their business.
And your information here is not just for senior citizens, although, if we live long enough, our bodies and systems begin to break down. That's what the whole aging process is all about. But as we see in the news every day and hear on the news and read in the news every day, young people can get in trouble with illnesses and injuries, and they should not have this information available.
Young people, young families. I mean, I've raised my child, but I can tell you, I would have given anything to have some of this information. I had no idea about most of this until I was at the other end of this. Until I am at this point in my career and this point in my life. And I think, God, if I had this information 20 years ago or 15 years ago, what a tremendous difference it would be.
Hindsight is 20/20, you know that.
Absolutely.
That's a good point for us to just stop for a moment, take a deep breath, and we'll be back. All right, I finished my coffee. By the way, we're sitting here in the atrium at Borders Books in Plattsburgh, Champlain Centers, on January 30th, 2006, talking with Deborah Ribis, who's written a book called Get Back on Your Feet, What Every Injured and Ill Person Needs to Know. Written based on almost 24 years of experience in the nursing business and case management and so on. And when I say there's valuable information in this book, I'm not kidding. You put the reviews in the front too, and on the back. Oh, I'm impressed. So, you can go through the book yourself, and I just want you to talk a little bit about basic information so people will know what they're finding. We want to go through the book chapter by chapter and just let people know what they can expect when they buy this new book.
Started out with dealing with your injury or illness. The first thing you need to know is, who are you dealing with? Who are all of the players you're going to be involved with, and who do they work for? The insurance adjuster that you're dealing with does not work for you. They work for the insurance company. Your doctor, you hope, works for you. I actually heard of a physician the other day who had the audacity to say that a patient who didn't have insurance, who had gotten so ill, probably deserved what they got. So you need to understand.
Hopefully that's not typical.
Well, hopefully not, but unfortunately it happens. So you need to understand who everybody is. If you're working with a case manager, who do they work for? Do they work for the insurance company? Do they work for an independent agency? Who does the rehab person work for? Some doctors are actually hired by the insurance companies. So it's important to know who the players are. Once you know that, you need to make sure, especially in today's world with managed care, excuse me, I think on the back of some cards it says you need to call in a certain number of hours and let them know whatever happened. Or if it's a work-related injury, you need to make sure that the forms are filed. If the paperwork isn't done, it can wipe out any chance you have of having the bills paid, and the bills can add up.
Oh boy.
They can be staggering, and you don't have any recourse. So you need to make sure that you follow the rules, and part of that is knowing what they are. If you have insurance, you need to play by their rules, and part of what this book does is it gives you the directions on how to find out where those are. I touched briefly in here on Medicare, SSDI, and Medicaid. They are federal agencies and they are state agencies. There are reams of information out there.
Oh,
and
yes. Oh,
so,
boy.
And you know that just
Oh,
from
boy.
dealing with this Medicare Part D
Sure.
problem. So I touched briefly on it and gave you some general information if you have questions, because a lot of people really don't know where to go to find the information for those particular, for the Medicare, the Medicaid, and the SSDI. A big chapter in this book is on record keeping, and I really go into a lot of specific depth as to how you need to be taking control of your own records. People assume that the doctor's office has it, or they assume, we said before, that the hospital does. You need to make sure you have it. You need to get your records. You need to read them. A lot of times they're about you, but sometimes they have other people's stuff thrown in there, and that can affect the outcome of your care. A big section is also educating yourself. It's a huge section. And why you need to educate yourself about the entire system you're dealing with. You need to educate yourself about your injury and your illness. We talk about your past medical history and why that's so important and how it affects us today and why it's important for people to be honest about it. For the good, the bad, or the ugly about our past history is where we are today. You didn't get to this point without having a history, and you need to be honest about it, because it can dramatically affect, it can kill you if you're not. Talking about retaining an attorney. A lot of times in the book, I will say, if you can't get the information you need, if you're being stonewalled, you may need to consult an attorney. You need to talk to an attorney, but you also need to understand that process. It can be very costly, and if you're going to be dealing with attorneys, you need to understand what they do and how they play into this. The 8th chapter talks about follow-up medical care and rehabilitation and what your options are. Some companies limit what your care is, some companies limit your follow-up. You need to understand how that impacts you and how you can get it extended if you need more. Medications and special equipment needs. Medications, well, you know with the Medicare Part D what a nightmare this can be and how expensive it can be if you're paying out of pocket. Independent medical evaluations, called IMEs sometimes, especially important for people who are on disability or applying for disability or who are on compensation. An independent medical evaluation or examination can be crucial to the outcome of your claim. And you really, really need to know what it's all about and follow the recommendations. Medical case management. I work as a case manager. As a case manager, you need to have your care coordinated. And you need to have it objectively coordinated without being directed and limited by outside sources. Vocational rehabilitation, we talked about that earlier, trying to find out, do you have other alternatives vocationally or going back to work? Returning to work. Once you get ready to go back to work, where do you fit into this whole system, and how does it work? We talked about late duty is not always late duty. I talk about transitional duty, making sure the release is individualized. Maximum medical improvement. A lot of people, I had no idea what MMI was until I actually reached MMI. And when you reach maximum medical improvement, it's a point in your care or your continuum where, regardless of what we do at this point, it may maintain you, but you may not be getting a lot better. It may not make a whole lot more change. Even if you had another surgery, it may not change the overall outcome for you. So you've reached MMI. That can have a horrible effect on your claim. It can affect you in a very positive way, but you need to understand where you are in that whole thing. I talk about friends, family, and community. Friends and your family and your community are going to be some of the biggest surprises you have as you progress with your illness and your injury, because their reactions may be totally different than anything you anticipate. And you'll be surprised who you can rely on and who you can't. And then I address a chapter of your new self. Once you've gone through this process, you are changed. And you need to come to grips with where you are in that process. How did I change? And where does it now put me back into my community and into my family? We talked about the glossary and the terms, the reference forms. I really strongly encourage everybody to make a binder for themselves. Fill out the forms and really just start making it your priority to get your records, take control of your health care, fill out your forms, and keep them current. You can't just do it once and assume that that's enough. You need to keep it current. Even if you don't go to the doctors except every few years for an occasional checkup, keep your information current, because I guarantee you something in there will have changed. We talk about the references in the back. I give you some resources so that if you're trying to do some research, where you have some good websites that you can go to or agencies you can access.
It's an interesting and I won't say all-inclusive book, because you've already said you'd like to add chapters from every now and again, but it certainly is it's a good resource.
Right.
And because you and I are friends, and because I like the way you do business, especially in this book, I think a lot of people should have this, if not on their coffee table for everybody to see, at least available. So if somebody gets involved in one of these situations, and if you have a family, it's going to happen at some point in your life. You've got someone to turn to, and at least on page 24 you can find out what to do next.
Well, when we looked at the statistics earlier, 880 million visits. Chances are somebody is going to, that you know in your family or your friends or your neighbors, are going to have problems. It's not a perfect world that we live in. The systems that we live in are clearly imperfect. So you need to be able to figure out how to get through them.
And there are so many choices. Having been recently retired from the formal working world, that is going to an office every day, then I had to become informed about Medicare, for example, and the extra insurances that you may or may not want to cover all your needs, because whatever insurance you have, you should study the policy, talk to the carriers, and know what's covered. It's like during Katrina and these terrible storms, people saying so-and-so wasn't covered. Well, it's probably in the contract that it wasn't covered, so know what it...
But they find out after the fact.
Yeah, instead of knowing, as you said, and I've learned from you to keep things in neat piles. I mean, my whole river room where my office is located consists of piles of paper. I'm one of those people that cannot read on a computer screen, so I have to print out everything like I did with your stuff this morning. And then I can read it, and then I can study it as I did for an hour this morning and digest it. But I don't throw it away. So keep things neatly and together, and when your health care, if you keep it all in one binder, right, and keep this book nearby, then you've got an instant reference.
Well,
right?
and the thing is, it doesn't just apply to those that have insurance. And I think that's
And
a
many
really
people
big.
don't.
I,
How
I
many
think,
people don't have any kind of
I
health?
gave you some statistics
Yes,
on that.
you
There's
did.
a staggering number: 64.2% of non-elderly Americans have employment-based insurance. And
18.3% are uninsured, 151 million Americans, 65, right? 64.2% of non-elderly population covered by employment-based hospital insurance, but there's always that nebulous section of people who have no insurance
they
at
can't
all,
afford it, and what
for one
happens?
reason or another.
And they gamble, and sometimes they lose. But the bottom line is they are still accessing the care, and they're the ones paying premium dollars. If you have Blue Cross pays a very small percent of what, let's say, your physician actually bills, or what the hospital bills. The hospitals in New York State bill a DRG rate.
What's DRG mean?
Diagnosis-related group, and they've taken the diagnoses and they've assigned them different weights, and they say exactly how much they will pay and how much they won't pay. If you are a self-pay patient, you don't have the benefit of that. So if you have your Blue Cross and your Blue Cross covers they'll say the bill is $15,000. Blue Cross may actually pay only $3,200 of that. As a self-pay patient, you're going to get to pay the whole $15,000. So it's important that you know what your benefits are. You may not have a benefit book, but you've accessed the care, and you have the right. If I'm paying $15,000 for something, I want the best of what I can get for that $15,000.
You know, the whole healthcare business has evolved so much in my lifetime. And you know, you're a baby compared to me, but in the years since you've been a nurse, it has evolved tremendously.
Absolutely.
And there are so many factors, I'm sure, questions. As people are watching this program, they're saying, wait a minute, remember when when you had glaucoma and you had cataracts, and remember what happened when you had cataracts removed and you were in the hospital for 5 days with sandbags on your head and so on, and now it's almost an outpatient operation?
It is. You go to the doctor's office and they do it as an outpatient.
But you know, this is run the gamut from appendectomies to gallstone, you know, to whatever. People are not kept in hospital beds nearly as long as they used to be. What I'm trying to say is everything is changing so much.
Right.
And by the time you write your next 1 or 2 or 3 books, whatever subjects they might cover, you know, this will be still good information because you try to keep this relatively basic.
Right.
But things will have changed down the road.
Things will have changed. They're trying to overhaul the compensation systems in this country.
True.
They're trying to have tort reform in the different states, which limits the amount. If God forbid you're the recipient of some malpractice, and you want to have a suit for some, you know, to try to recoup some of your losses, many states have put limits on that. Our current president is really big into, you know, limiting what corporations and hospitals and doctors are going to have to pay. And where does that leave patients? So you need to understand what is going on around you. It's not just a matter of being able now to kind of go with the flow, because the flow is changing. And if we aren't aware of what's going on, all these laws that are being enacted are going to affect us, the individuals in this country. They don't really affect our lawmakers a lot.
I don't know if we mentioned, I guess we have once or twice, that this book is published by Women in Print, right? And people can access that website at www.womeninprint.com.
Correct.
And find out a great deal of information about you and about this company and so on, where the books might be available. You said as of the 30th of January they'll be available here at Borders Books. And elsewhere as the demand increases, and hopefully it will, again, not just to make Deborah rich, but to educate the public in what they need to know about taking control of their healthcare situations.
This book, I personally see it as a public service. This is something, you know, when you go to the doctors, they have rows of pamphlets that they hand out for you. I think it's important that you have the information in here. I've tried to give the good and the bad and the ugly of all of the situations. Not every situation is bad, not every situation is good.
You know, I have to tell you that knowing you has been a pleasure. Knowing your
Thank you.
whole family, your son, your mother, your late dad, the late Papa Joe. I could write a book on your father.
Yes.
So could you. And I've written about him often, but I could write an entire book just on knowing him and how inspired we were talking with him. Because you know, when he loved you, he loved you, and he would do anything for his friends. And he was a great music lover, so we had a lot of things in common. And because you're your father's daughter, your mother's daughter, and because you are a well-educated, strong individual, very knowledgeable in the nursing business, I've embraced the ideas that you've put forth in this book.
Thanks.
And because I think it's good information.
Well, I've tried to put it so that you can use it or your kids can use it. I tried to make it kind of a cross-generational book.
Yeah.
You know, because it affects all of us.
You know, one thing that dawns on me before we leave, I want to mention, can you give me your email address if people want to correspond with you about this book?
dribis@gmail.com.
Ribis, R-I-B-I-S.
Right, at gmail.com.
Gmail.com. And I'm sure you'll be willing to take comments of all kinds and
Oh,
at
absolutely.
least for a while respond to your thousands of fans.
I respond to
If
everything.
you can't do it, your son will show you how.
Really.
Deb Ribis, thanks so much for being with
Thank
us
you
here
so much.
today. We're at Borders Books, Champlain Center on the 30th day of January 2006, and we expect updates, regular updates from you, letting
You
us
will
know
have them.
how
You will
things
have
are
them.
going. Thanks so much for being
Thanks so
with us.
much.
Thanks to Calvin for holding that camera as he has for all these years, for Hometown Cable, for all of our viewers. And if you like what we do and this kind of interview and the other programs we do, please take a little time to open your wallet and support Calvin and Hometown Cable. It's very important to keep what he does on the air for another 24 or 5 years. Thank you all for watching. Your comments are always appreciated. And who knows where we're going to be next time for our little corner.